Morning, everyone, and thanks very much for joining this launch event for SITFA's new publication, Charging for Adult Social Care in England, Reform and Routes Forward. For those of you who don't know me, I'm Aileen Murphy, ex-National Audit Office. I've done quite a few pieces of work on adult social care. I'm accompanied here by Dr. William Burns from SITFA, who's been a great force in driving forward this particular publication, and welcome also to Vicky Davis from the National Audit Office, who's just produced a very interesting report on adult social care, which she's going to talk about in a bit, which answers the interesting question about what happened to all those billions that were committed for reform. But I don't want to ruin Vicky's surprise. So just a few housekeeping notes from me. This will be recorded. It will be available on the SITFA YouTube channel in a few days' time. If you want the slides, they will be available as well after the event on the SITFA website. If you want to ask a question, put it in the Q&A box, and we'll get to them at the end after everyone's presented. So just to reiterate my welcome again, and thanks to SITFA for deciding to produce a report on this very important topic. I chaired the working group on this. I'd like to thank the panel members, Sir David Pearson, well known to many of you, I'm sure, William House, Karen Fuller, Naeem Ahmed, Richard Humphreys, Ian McBeath and Kath Roth, all of whom were very generous with their time and helped produce a really incisive piece of work. So moving on, I just wanted to say a few words about adult social care and its current state. I think we can all agree before we. I think we can all agree that adult social care, when it's provided well, it helps everybody. It helps people who receive it to have to make the most of their lives, improves their well-being, etc. But I think we can also all agree at the moment the state of adult social care is fragile. It's fragile in terms that its scope and depth of services, unmet need is rising. It's fragile in the sense of its financing. It's part of the whole picture of the weakening of local government finance. And just at the end of last week, we saw yet another Section 114 notice from a local authority in trouble, Nottingham City Council. And the demand in social care, both children and adults, were a key factor in them not being able to carry on financially. It's fragile in terms of its workforce. I'm not going to talk about yesterday's announcement on migration, but that's obviously going to have a big impact, and perhaps we'll get to it in the Q&A. But we've got a workforce of 1.5 million, but 150,000 vacancies. And those vacancies cluster geographically and in domiciliary care. And we've still got a 30 to 35% turnover in the sector, which is obviously a tremendous cost to providers and a waste of resources. We still have the fact that, you know, in any given town in England, if you open up an Aldi, then you're going to lose staff from social care. So there's something here about it's low paid, but it's absolutely not low skilled. And as a country, we need to do something about that. The social care market is fragile. Providers are complaining that there's not enough money in the system, particularly in domiciliary care. And we're about to start on another winter where social care as a service is going to be playing second fiddle to the NHS, and no doubt come in for a fair amount of blame for people who are, as they put it, stuck in hospital because there isn't care to discharge them to. So without unduly depressing ourselves, because we shouldn't, those are the problems that the charging for adult social care reforms are attempting to address. So what SITFA's done is set out a set of 5 principles for reform, and William's going to talk everyone through about the principles and what they mean, and judging the current reforms against them. But essentially, I think the government deserves half a cheer for bringing forward at least some reforms into trying to improve adult social care, because things haven't really changed for a long time. And those of us who are getting on a bit, like yours truly, will remember back to the Sutherland Commission and trying to boost integrated care and something that looks a little bit like a national care service. So half a cheer for at least attempting reform, because these are big, difficult questions, because they go to the heart of what the relationship is between the individual and the state, and how much you contribute to your own care, and how much the state should help people, particularly with catastrophic care costs. So the reforms essentially mean that you can keep more of your own money, and up to £86,000 will be paid for personal care. Those are the main things. So that will help some families in some ways. But are they equitable? Well, I think there's a debatable point about there. Are they fair between generations? Again, that's a debatable point as well. And there's a number of other aspects to it that maybe mean that they're not looking at really important issues that need to be settled, like workforce regulation, proper training, etc. So that's where we are. So what we're going to do next is I'm going to hand over to William, who's going to talk you through the SIPFA publication, and then William will hand over to Vicky. She'll talk you through the new National Audit Office report, and then we'll end up with questions at the end. So hope that gets us all the way through to lunchtime. So next up, William, it's you.
Okay, thank you very much, Aileen, and thank you for everyone for attending today. So my name is Will Burns. I'm the author of SIPFA's latest report, Charging for Adult Social Care in England, Reform and Routes Forward. I'd just like to echo what Aileen said there, that in writing this publication, I was supported by a reference group, and their insights were really formative to this document. So I'd like to echo Aileen's thanks to the members there. And yeah, I'm going to speak a little bit about our report's findings today, and then I'll be handing over to Vicky Davis, who was speaking about the National Audit Office report on adult social care reform. So a little bit about SIPFA first. We're the only professional accountancy body in the world dedicated exclusively to public finance. We're committed to effective public financial management and supporting the financial sustainability of local authorities across the UK. So for those local authorities with adult social care responsibilities, social care comprises a significant proportion of their budgets. So proper financial management in social care is not only crucial to ensuring that people receive the quality of care that they need, but it's in fact at the heart of local authority financial sustainability. And as Aileen referenced there, we've seen in recent months an increasing number of local authorities issuing Section 114 notices. And our CEO, Rob Whiteman, has recently written that future Section 114 notices may occur because of councils experiencing difficulty covering significant service pressures, with increasing pressures for demand-driven adult social care and children's services typically among the key drivers. And this holds out in what we're hearing from local authorities themselves, with a number of local authorities explicitly citing pressure from social care as a primary cause of budget gaps. So the charging reforms that we'll be discussing today were originally planned to be implemented in October 2023, but following the autumn statement last year, the implementation date has been pushed back to October 2025. So this gives us the opportunity to take stock of the reforms, consider possible future directions, and make a series of recommendations to government on charging reform. So building on our previous thought leadership in social care, including the road to reform, COVID-19 is a catalyst for change in funding social care, which you can access for free on the SIPFA website. In this publication, we put forward 5 principles for a sustainable and equitable social care system. So these are, number 1, start with a fresh understanding of needs, demand, cost, and spending, a zero-based approach. So this principle is about understanding the full implications of proposals for reform. So we need a clear understanding of needs, demand, cost, and funding. And taking a zero-based approach across the board would enable a broader view of how costs and funding might be rebalanced. Number 2, provide adequate long-term funding and certainty of funding for social care services to recover and secure their financial sustainability. So this principle will enable more effective public financial management across social care. So social care requires sufficient funding in the short term to recover, and then additional funding to reform. Otherwise, there's the risk that other local authority services will suffer, or that reform funding is spent on dealing with current pressures. Number 3, invest to rebalance spending from reaction to prevention and to achieve value for money in the long term for the public pound and better outcomes for people. So this principle encourages investment in preventative activity, which is important for health and well-being and maximising value in the long term. So there needs to be a change in mindset around preventative action, viewing it as an investment for the future, and hopefully bringing benefits for the future financial and operational sustainability of services. Number 4, address unfairness in how the costs of care are met between generations, by place, income, and wealth, and protect individuals of all ages against unlimited costs by pooling risks. So this principle aims to ensure that inequity in social care is reduced and that unlimited costs for all people of all ages can be avoided. Any reforms to the social care system should not advantage one group in society over another. And then finally, our 5th principle then is about reducing the barriers between social care and other public services to ensure greater policy alignment across government departments and financial alignment around the individual. So this principle encourages joined up working to maximise the strengths of all partners in a more integrated system and avoiding individual disadvantage by different charging regimes. So some areas of government policy remain misaligned with charging policy, and that's something that we need to address. So in our publication, we ask whether different charging scenarios meet our principles, but importantly, these principles aren't specific to social care charging, rather they can be applied across the whole social care system, but in the publication we apply them to charging. So first of all, we'll just talk quickly about the current charging system. So people need to pay for social care from their capital and income unless they qualify for local authority financial support. So as a reminder, if an adult has a care need, they can either pay for their own care, there'll be a self-funder, or they can approach their council for financial support. Given that they meet eligibility criteria, a financial means test will be carried out, and there are 3 outcomes from that. So if you're above the upper capital limit, you will have to fund your own care. If you're between the upper and lower capital limits, there's a tariff income of £1 per every £250 between the 2 limits. And you'll also need to contribute from your income. And then below the lower capital limit, you won't contribute to the cost of your care from your capital, but you will still contribute from your income. So as a reminder, the lower capital limit is currently £14,250 and the upper capital limit is £23,250. So there are a host of issues with the current charging system. There's no limit to care costs aside from your personal wealth, which can result in some people with long-term and complex care needs experiencing unlimited care costs. So the government estimates that 1 in 7 people aged 65 face potentially catastrophic lifetime costs of over £100,000. The current system is difficult to understand, with charges calculated using a complex calculation covering people's capital and income. And so this can actually hinder people from effectively planning for their own care. Criteria for public financial assistance is increasingly restrictive. The capital limits haven't gone up with inflation since 2010 and 11. So that means that fewer people are therefore qualifying for support with their care costs, which is adding to the problem of unmet need. And importantly, care markets are unstable. So in a National Audit Office report, we heard that most local authorities pay unsustainably low rates to providers for care home placements. And this year, for the first time, the National Risk Register included a major adult social care provider failure as a risk that would have a substantial impact on the UK's critical systems at a national level. And we go through some more of the challenges in the publication. So as you can see, we go back to these 5 principles that we've established at the start of the document, and we ask whether these different charging scenarios meet our 5 principles. And as you can see from the current system does not meet any of our 5 principles. There isn't that fresh understanding required because the current system has remained unchanged in principle for almost a century. The charging system does not provide stable and adequate long-term funding. There's minimal financial sustainability. It doesn't encourage investment in prevention. It's inequitable. People aren't protected from unlimited costs. And actually, it can be argued that the current charging system can act as a barrier for closer integration with other services, including health. So as a reminder, here are the charging reforms that are currently the government policy. So we have the current system, and then we have the proposed reform. So currently, as I said, the lower capital limit is 14,250. That's going to be increased to 20,000. The kind of sliding calculation in between will remain the same, £1 per every 250. However, the upper capital limit will increase quite significantly from 23,250 to £100,000. Where there isn't a cap at the moment, the government is going to introduce an £86,000 cap, which will be your personal care costs. It won't include your residential fees or your daily living costs, and actually won't include local authority contributions either. But we'll come on to that in a bit. Implementation of Section 18.3 of the Care Act. So Section 18.3 of the Care Act would allow individuals to approach their local authority and request that they provide their care for them, or arrange their care for them, sorry. Currently, that's not being implemented. Under the proposals, it will be implemented. And that's something that currently local authorities only do for people who are in receipt of financial support. So this would be anyone can approach their local authority under Section 18.3. And then we have the fair cost of care and market sustainability. So this reform involves local authorities moving towards paying providers a fair cost of care, which refers to a median amount determined in a cost of care exercise that can be paid to providers to bolster market sustainability. So in the publication, we explore the cost of the reforms, ask how the reforms are being funded. We go through each of the reforms in turn and we ask, what is the reform? What issue within the current system is the reform seeking to address? What are the benefits of the reform? And what are the problems with the proposed reform? So as I mentioned, they were originally meant to be implemented in October 2023, but after the 2022 autumn statement, the Chancellor Jeremy Hunt announced that these would be delayed until October 2025. So the government said that they'd made this decision because they had listened to the calls from local authorities for a delay. And it is true that the Local Government Association had called for a short deferment to some aspects of the reforms, although I don't know if they were expecting a delay such as this. In terms of how the reforms were to be funded, the government announced in the autumn budget and spending review that £5.4 billion would be provided for adult social care reform from 2022-23 to 2024-25. So that included £3.6 billion routed through local authorities for charging reform, with the remainder going to wider sector reform. The government proposed a 1.25% health and social care levy that would be based on national insurance contributions and dividend tax to raise funds for health and social care. And that was going to fund the ring fence, the £5.4 billion for social care reform. However, that levy was scrapped in September 2022 by the then Chancellor Kwasi Kwarteng. And we were told at the time by the then Secretary of State for Health and Social Care, Therese Coffey, that investment would remain exactly the same, but we never really got any further detail on that. After delaying from October 23 to October 25, the Chancellor announced that 3.2 billion of the 3.6 billion pounds for charging reform would be redirected to help local authorities deal with current social care pressures. So I think local authorities were pleased to have that money to deal with the really challenging issues that they're facing currently, but it does put a question mark over our progress towards reform there. In terms of shared challenges of the proposed reforms, well, they're going to come with a greater cost to local authorities. Each of the reforms will mean greater costs, both financially and in terms of human resources. Insufficient time for implementation. So in our briefing on the reforms following a roundtable with social care leaders, local authorities said that they had insufficient time to implement the reforms. So if the reforms are going to go ahead, work is going to need to begin as soon as possible to give local authorities the time to prepare and make a success of the reforms. There's a challenge around policy alignment. So another issue that we heard was that as well as having insufficient time to implement the reforms, the local authorities were being asked to do too much all at once in a short time span. So they were being expected to carry out their cost of care exercises, write market sustainability plans, develop processes for metering people towards the cap on costs, analysing the impact of the reforms in their areas. And they were having to do all this while dealing with the current crises that we're seeing in the workforce and with increasing demand. Next up then, there's the political agreement point. So it's important to note that this October 2025 deadline is going to fall on the other side of a general election, which has created uncertainty as to whether these reforms are going to go ahead as planned. And this lack of a clear policy direction is always going to be a problem unless there's some kind of cross-party commitment or agreement to a shared vision to deliver reform. In terms of the main cost areas of the proposed reforms, well, increased assessments, reviews, and care management responsibilities as more people become eligible and come forward for assessment and financial support. So there's estimates that it would take around a further 200,000 assessments per annum, comprising 105,000 Care Act assessments and 93,000 financial assessments. So that's going to require a lot more staff. Some estimates give it over 4,000 social workers. So at a time when we're having a workforce crisis, having an extra 4,000 to bring about these reforms is going to be a challenge. The more generous means test will mean more people are eligible for local authority financial support, which will increase the amount the public sector contributes towards care costs. The introduction of the cap on personal care costs, local authorities will have to track people approaching this cap and will have to pay for personal care once an individual reaches the £86,000 cap. There's the local authority administrative and operating costs of arranging care for self-funders under Section 18.3 of the Care Act. And then there's funding the difference between what is calculated as a fair cost of care in an area and what the local authority is currently paying. And we've heard some eye-watering figures from stakeholders such as Care England on that. So as with the current system, we measure the government's proposed reforms against our 5 principles. So I won't go through each of these in turn, and you can find out the more detail in the report itself. We give some narrative explaining how we've arrived at these markings. But as you can see, the proposed reforms either don't or only somewhat meet SIPFA's 5 principles for a sustainable and equitable social care system. So next in the report, we take 3 social care roadmaps that have been published in 2023 and examine what they say about charging reform. So this is about the possible routes forward angle. So these 3 reports are from the Fabian Society, from the Association of Directors of Adult Social Care, and from Care England. So these reports were selected because they give us a cross-section of social care stakeholders. So the Labour Party commissioned the Fabian Society report, so we can consider this to be Labour's possible social care vision. And establishing a national care service has been a feature of Labour social care policy for over a decade. With ADAS, we have the local government view from local authority adult social care leaders and the body that represents them. And then with the Care England roadmap, that's giving us this provider view. So in the report, we'll give a little bit of background information to each of the reports and the organisations behind them, and we look at the recommendations from each of the reports relating to adult social care charging reform. And again, we return to our 5 principles for sustainable and equitable social care, and we ask whether the charging reforms from the reports meet SIPFA's 5 principles. So as you can see, the selected roadmaps perform better than the current system, and the government's proposed reforms, with ADAS scoring most highly. So before speaking about the recommendations that we make in the report, I'd like to speak a little bit about our conclusions. So as I've described, we have looked at the challenges of the current system, considered the government's proposed reforms, and looked at possible future directions and selected roadmaps. So we found that the current charging system is flawed, and so too are the government's proposed reforms. That the main challenge around the reforms is their cost. Likewise, if the reforms are not fully funded, then that's likely to mean that other local authority services are going to suffer, as local authorities have to prioritise their statutory duties. I think importantly, charging reforms alone are not going to solve the problems in social care. They're quite narrowly focused and they're not a silver bullet. And actually, there are some current challenges that need to address before we reform the system. Now, this is not to say that we should put reforms on ice or kick it into the long grass, as has been done time and time again, but rather we need to kind of press ahead with the reform, but also we need to make sure that we're building it on solid foundations. We can't create a reformed, thriving system from a deficit baseline. And just finally then, I won't go through every single one of these recommendations, but I'll just quickly go through them. Maybe we'll have some time to talk about them later, the Q&A. But as you can see, I've kind of put some icons here so you can see that the recommendations are centered around our 5 principles again. So we have some about the zero basin and the fresh understanding, some about funding, about reinvestment into prevention, about addressing unfairness, and about policy alignment. These go from carrying out the zero-based spending review exercise, so moving away from this incremental budgeting approach where we spend more and more money every year without necessarily improving outcomes. Well, so starting from that zero base, understanding how money could be spent most effectively to achieve intended outcomes and how that can be measured. And it goes on. But I won't go through each of these. I'll better not be selfish with my time and pass over to Vicky. So thank you very much for listening to me so far, and I'll pass over to Vicky now. Thank you.
Thanks, William. Just going to get my slides working. Bear with me. Just while I do that, just to say, by way of introduction, I am really happy to be here to talk about this report, and I am the Director of Local Government Value for Money at the NAO, and I am the director on this piece of work. I am struggling to put this into slideshow view, so apologies. Hopefully people can see this okay. I will go through as I am, if that's okay with everyone. So just to come on to start why we reported on adult social care and why we reported now. So we had quite a back catalogue of work on adult social care, as Aileen has already mentioned. So we've done work on the workforce for care before. We've talked about the COVID response as well in 2020. And then in 2021, we looked at the adult social care market in England. And the report that we've just published at the start of November is very much a follow-on to that. And so we update some of the things that we were saying and recommending there as well. But really, this latest report is all about reforming adult social care and what that means. And we felt the time was right, really. There'd been some changes to the reform plans that William has outlined, some changes to the funding that had been announced, and we thought there was an important role for the NEO to provide some clarity and transparency around that. And of course, as has already been mentioned, this is a huge area of significant and rising financial pressure for local government. So as you've already heard, government set out in 2021 5.4 billion it was going to commit over a 3-year period. Majority of that was for charging reform, at 3.6 billion. The rest was 1.7 billion for wider system reform. And our report talks about the whole piece, but then largely goes on to focus on the system reform aspects of this. So after the long-awaited vision, which was broadly welcomed in 2021 by the sector, the goalposts moved rather, and pressures began to emerge that really started to compound issues that had already been there in social care, and the challenges that there were. And so what was happening was, obviously, you had rising inflation, higher than expected, putting additional strain on local authorities and providers as well. And you also had, and this is quite a live debate, if I'm honest with you, about hospital discharge. There was a lot of conversation around, what impact social care and capacity was having on the ability to get people out of the hospital. And certainly ministers, while the sector wouldn't necessarily agree with this, ministers believed that there were difficulties arising from social care that were contributing to some delay in getting people out of hospital. And then also there were already signs that the system reform side of the reforms that had been set out were behind schedule. And certainly the Department of Health and Social Care were advising that was sort of taken into wider considerations as to what would happen next. As William's already mentioned, the LGA, certainly, I'm sure there were others, were raising concerns about the ability to bring in charging reform along the original timeline of October 2023. So what we saw in 2022 was government respond to that and pause those charging reforms for another 2 years to October 2025. And what they also did was they looked at different funding and putting funding into the system to really tackle some more of the immediate pressures that were arising. So it was to tackle pressures, give some stability to the system, which is always helpful before you're trying to reform. At the same time, there was an expectation you would still see some system improvement alongside that. And our report sets out really what the breakdown of funding looked like, the additional funding that was coming in. So essentially the 3.6 billion that was set out for charging reform got reallocated and repurposed and was designed to tackle immediate pressures. So you had some going into specific funds to help with the fees being paid to providers, to help with waiting lists, and also the workforce. And then the bulk of that charging reform money was going out to local authorities through social care grant. And it was for local authorities to decide how much of that was going to be for children's and how much was going to go to adults. Then we saw some additional funding coming in. So 2.7 billion of additional funding, again, for specific funds to do particular things. Largely the Market Sustainability and Improvement Fund, again, to do fee rates, workforce improvement, and to bring down waiting lists. And then, as has pervaded for the last few years, the adult social care precept and the ability to increase council tax to raise more money for adult social care, reliance on that. So 1.7 billion coming through that. Earlier this year, so in 2023, the Department of Health and Social Care had done some analysis to really gauge whether the additional money going in looked like it was going to help and do what they wanted it to do. Now, the caveat around this is very much done as a national picture, a national assessment. And what that showed them is that overall, there was reasonable coverage to meet the cost and demand pressures that were emerging. So when the money was set out for local authorities back last year in the local government financial settlement, there was still an expectation on local authorities that they had this extra money, and there was an expectation they would increase what they were spending compared to what they'd spent in the previous year. And the aim was that this would go beyond just meeting inflationary pressures and that they would improve services. What DHSC found in their analysis, that actually across the piece, it looked like they were going to largely meet their expectations. But some did not meet their expectations. So if you take it down to an individual authority level on the analysis, it looked like some authorities would not be spending more and enough to make system improvement. Equally, coming away from system improvement right now and just thinking if they just met their cost pressures on existing capacity given, the department found that it would be enough again overall, but there was a concern that 1 in 4 authorities might fall short here. And when it comes to capacity, most were able to say that they thought they'd have enough capacity in the system to meet the requirements. But 1 in 6 thought that their capacity for care delivery could be exceeded. And so there wouldn't be enough care for people. Now, this, as I say, this was earlier in the year. But what we did note in our report, of course, is that there are long-standing issues with the way social care is funded. I've mentioned the adult social care precept and council tax flexibility already. There's been a reliance on that. And, you know, what we see is actually the places that can raise the most money through that mechanism are not necessarily the ones that have the most call on local authority funded care. The formula that's used to distribute money out to local authorities is out of date. It's not been updated since 2013-14. So it isn't reflective of the needs in particular areas. And some years ago and before COVID, government committed to reviewing all of this, and that hasn't happened yet. The other thing I would reflect, and our report covers a lot of these funds that have popped up to do specific things and to help with the immediate pressures, is that there are more different funding pots that have been created as well. So that's where a lot of the money has gone. So one of the things we looked at is the budget for system reform was 1.7. It was actually 1.74 that was agreed in the spending review for 2021. And we looked at, well, what has happened to that budget for system reform specifically since these changes in 2022. Now, the budget for system reform now stands at 729 million. So that's a 58% fall on what was proposed in 2021. The next steps paper, which was, if you like, an update to the white paper that had been published in 2021. Next steps published earlier this year. And I think it's fair to say there was some disappointment amongst the sector in terms of what they saw as a scaling back of the intention. Our report sets out what was in the white paper in terms of funding by different policy areas versus what had been spent in the first year of the 3-year period, and then what remained in the next steps paper, which is covering 2 years, the remaining 2 years. And I think the most significant change was around workforce. So white paper in 2021, the amount of money for workforce reform, 500 million. It's now up to 250 million in next steps. And the other thing was some funding to integrate housing and bring that more into health and care strategies was abandoned. So we can see quite a difference there. The question then remains, well, what happened to the rest of the budget? What happened to the 1 billion that was set aside for system reform? Now, again, our report shows where this money went, and what you can see is that it has largely still gone to help tackle other adult social care priorities, mainly, as I say, dealing with some of those more immediate pressures. So a lot of it's gone into one of these funds, so the Market Sustainability and Improvement Workforce Fund. Some has gone towards discharge, some has gone into urgent and emergency care. There is some money still there, 37 million for charging reform implementation. And so this is how you get to 729 million. But I think it's right and balanced to reflect that money did not get lost. It did not get taken away. It just got put into different places to do different things than had been envisaged back in 2021. Also in our report, we look at the progress around system reform. So bearing in mind where the plans have changed, how is it going? And our conclusion here was, well, you know, they're behind on that revised plan, and there is still some way to go if they're going to deliver the vision that was set aside in 2021. Particular areas, so there was less progress overall in 2022-23. Most progress was in the areas around digital data and assurance, and that makes up, unsurprisingly, most of the spend in 22-23. The areas that haven't made the most progress are really around the workforce. So there are 8 projects under the workforce area of system reform. 2 of those are furthest advanced. That is around international recruitment and volunteering. And I'll say a bit more about international recruitment shortly. But the rest are in development. The highest budgeted reform here is around enhancing workforce training and development. That's at 136 million. So you can see it is a big chunk of the workforce element of system reform. And that's delayed. And it's delayed because of issues and it taking longer to get the payment system set up to get the money out to providers to deliver that. I mentioned earlier signs of challenge in adult social care that had existed before the response in 2022, and obviously higher than expected inflation. And it would be right to show and recognise that there has been a sort of downward trend in some of these numbers. So I think it's right to reflect there's some signs of improvement here. And the 2 charts we've got here, the one on the left is the one around the number of people that are waiting for some form of assessment. The 2 most important, I think, are the middle and bottom line. So the middle line is the number of people waiting for an assessment. And you can see that has gone down since a high in April 2022. But starkly, the bottom line shows that there's an upward trajectory. So while overall less people are waiting, within that, people are waiting for longer. So people are waiting more than 6 months for an assessment. That's, you know, more than double the amount that there was back in 2021. And on the right hand side, we've got our workforce vacancies and vacancy rate on this chart. Now, again, what you can see is a real peak in 21-22, perhaps relating to the after effect of the pandemic, and a slight improvement in the most recent data, which takes us to 22-23. There is still 150,000 vacancies in adult social care. It's still a 10% vacancy rate. So we need to recognise the improvement, but you know, there's clearly a lot more to do. And Aileen mentioned earlier the turnover rates as well amongst the workforce. Now, the decrease we've seen in workforce vacancies is largely due to overseas recruitment. So 70,000 staff were recruited from overseas, which must mean that there is a gross fall in our domestic workforce that are going into the care sector. And we are all aware that this is a very challenging labour market to be operating in the moment and to recruit people. And as I say, the comparison to what would you get if you were working in retail is a really live debate. Just finally on this one, I would say that, you know, the pressure on local authorities remains very stark. We've got directors of adult social services really saying they're not sure whether they're going to be able to meet their statutory duties around adult social care. And as already mentioned, the risk of a major provider failure is on the National Risk Register, and those profit levels, specifically for care homes for older people, are at one of the lowest levels they've been at since CQC started overseeing the health of the market. So we set out in our report some fundamental risks to delivering government's reform plans. One of which is actually restarting charging reform to deliver alongside the system reform. So to deliver by October 2025, charging reform, you're going to be layering on more staff than you're trying to do currently with system reform. So that's going to add to resource pressure, both within the Department of Health and Social Care, but also out in the sector. There's remains uncertainty over how much a fair cost of care will actually mean, what it will look like. An earlier exercise, the department had a number that it thought it would cost, but, you know, an acknowledgement that they're going to need to run that again. And, autumn statement obviously rightly increased national living wage, but that's going to come through in some respect in terms of who's going to pay for that. Also, we talk about the experience to deliver this. You know, we've got to recognise there is not an NHS for adult social care. That's not to say that there should be, but we just need to recognise there's a very different dynamic for central government to work through when it comes to social care reform. And as an office, we talk quite a lot about funding certainty. This is a long-term plan that was set out in 2021. It's a 10-year plan. It's a vision, and that requires some element of funding certainty and recognizing that there is investment to happen here, and you know, we've said it before in 2021 in market overview that providers will not invest if they don't have that certainty. Equally, there's a lot of moving parts in this reform. It's a transformation, so really need to have a very clear mechanism for setting out how all these planned changes, how DHSC will get there, and everything that it's set out in the white paper. So to finally cover off just my final thoughts, I wanted to share with you the conclusion that we had in our report, which was really to say that looking ahead to reform adult social care and be successful, there are these significant risks, and the ability of local government to pick this back up, to pick up charging reform alongside what it's already doing. As the NEO, we will look at what central government needs to do here, and we say that it's very, very important that the department understands how all of its reforms interrelate and what that all means for local authorities. So they need to know what the critical steps are, manage that delivery risk, and make sure that they're across that to make any changes that they need as things progress. In terms of recommendations, well, along those lines, really, we encourage the department to assess the impact of all of its reform interventions and set out what the cumulative impact is on them and make sure it's manageable. We talk about the importance of a costed plan as they return to charging reform and bringing in the lessons learned so far. So, for example, the trailblazer work that was done for charging reform, really incorporating that as it picks charging reform back up again. And we encourage, from a position of transparency, that there is a long-term plan published that really maps all the different reform activity and the funding needed, so that we can see how it leads to achieving those outcomes that were first set out in 2021. That's it. I'll leave it there and open up for questions.
Thanks very much, Vicky. Exercising, before we get to the ones in the chat, exercising Tua's privilege, I just wanted to ask you, Vicky, and to you as well, William. So where are we on the progress towards a reformed social care system? How much progress are we actually making? You both alluded to bits, but give us a kind of like, how far along the road are we?
Okay. If I can go first, William, if you don't mind. So I think, as we say in our report, Aileen, there's a long way to go. So we're two years out of 10 for the vision for system reform. So that can sometimes mean it's quite hard to judge with 8 years left on something, but it does feel like there's quite a long way to go. Obviously, things changed quite dramatically from what was set out in 2021. I think there are some positives that we could, there are positives that we do and can pick up on, not least that there was a vision that was broadly welcome, and there was sort of buy-in and engagement there, and I think there's a real impetus and will to do what's needed here. I think for us, it's exactly as I set out there with the conclusion, the recommendations. It's making sure that there's a real grip on how all of these things come together and what it means and requires of the sector, and really tightly, checking and managing those risks to delivery.
William, do you want to add something quickly there?
Yeah, I would say, I think to echo what you said at the start of the session, Aileen, I think it's good that there is some, movement going on, that the government is making some kind of effort to get the ball rolling on this. I think the stop-start nature of it isn't very helpful, though. I think like local authorities have struggled with that. But in terms of like maybe what's next steps, then I mean, if we're serious about implementing, I'm talking about the charging reforms here. If we're serious about implementing these by October 2025, then work's going to have to resume on them very soon. We had Karen Fuller, interim director for adults in Oxfordshire, on our reference group, and she was interviewed by the LGC. She was asked a similar question, and she said that the work's going to really need to begin at the beginning of 2024. And we're going to need to make sure that all of these reforms, as I kind of alluded to in my presentation, they're going to have to be properly phased to make sure that so that to maximise the chances of success. And we also need to be taking into account the competing priorities the local authorities have. So, and again, I would reiterate that point about the implementation date for the charging reform falling on the other side of the general election. We don't want local authorities to begin this work at the beginning of next year, for then the general election to happen, and then for that work to go to waste. So we need to make sure that the work that is done will have value. But it's a risk that we need to take into account.
Yeah, and I think it's interesting that you're positing an election in January 2025. Of the possible dates, I mean, is that the most likely? Anyway, leave that one there. Just picking up from the chat, comment from Andrew Buck and a question about unmet need and latent cost pressures that will come to hit local authorities. But I mean, the more important question he's posing is, where's the national workforce strategy across the NHS and social care to address the workforce gaps? Which, with the Home Secretary's announcements yesterday, it's just got, I think, slightly more acute. Anyway, workforce strategy.
Yeah, I mean, as you will know, Aileen, that is a recommendation that the NEO has made previously. The Committee of Public Accounts has made the same recommendation around workforce strategy. My understanding is that there is a feeling that the white paper was in effect the strategy, and I think that could be debated as to whether it is. But as you say, certainly it would not be unhelpful to have more detail on those plans, not least announcements such as yesterday about what that might mean for the ability to recruit overseas as well, and what is the appetite for baking that in, if you like, to the workforce model, a reliance on overseas staff.
Yeah, I think the chart in your report, Vicky, on the part played by overseas workforce is really telling. To go back to the chart. Sorry, William, were you wanting to comment there?
No, I just thought you would have liked that question, Aileen, given that I think you took part in a number of reports that called on for a workforce strategy in social care, didn't you? So
yeah, I was trying to avoid having to fess out to an absolute and complete professional failure on that front, because I never managed to get the Department of Health to do it, despite their promises. But a comment here, or a question from one of our audience: is there a risk that adult social care reform will be ignored until after the general election? Do we think that's a real risk, politically speaking?
Well, I'll come in. I mean, as I've said, I think there is the real risk that there's going to be, like, if we're going to get this done in time for October 2025, if that is a serious implementation date, then work is going to have to begin very soon on that. I don't think we've heard from the Labour Party whether or not they're going to be pursuing these charging reforms specifically. There's a lot of recommendations in that Fabian Society report that do include recommendations around charging reform, but we still have yet to hear some kind of firm Labour policy on this, and whether we're going to hear that. Well, I guess we'll hear that when a general election is called. So yeah, I think it is something that we need to bear in mind, and we need to make sure that the work that we do in local authorities to prepare for the reforms is work that is work that will have value regardless, whether that's something about organisation and teams and a better understanding local populations, things like this, that will still have value even if the route changes slightly.
Fine. Another question here from the audience: isn't the fundamental issue here actual care provision, its capacity, and whether or not funding's adequate? So rather than looking at the processes, isn't there just that fundamental problem? Is there enough money in the system? Nobody wants to take that one. Okay.
Well, I mean, I know. I mean, I'm happy to take that, and it's partly to do with one of our first recommendations in the report around that zero
Yeah.
basing thing,
Yeah.
and it's about I mean, we can't keep throwing money at the system that and not getting these better outcomes. So I mean, of course, it's around provision and it's about capacity and it's about innovation, but there are other things. So, for example, the short-term funding settlements that we're seeing on social care, it's impeding local authorities from being able to properly plan and improve and innovate.
Yeah.
Yeah, I do agree with the questioner there, but and if he reads the report, he'll see some of our recommendations that may be able to help with that.
Just one thought, Aileen, on that is
Mhm.
is obviously that the conversation about fair cost of care. What is a fair cost of care is still a very live one, and will
Absolutely.
need to be returned to as thinking about charging reform. So what is the right amount of funding to put in from the public purse into providers to deliver certain things? And I think the other thing we haven't mentioned so far is CQC's new role in terms of overseeing local authorities and their discharging of their duties under the Care Act, and what that might bring in terms of some visibility and oversight of that. As William said, a lot of money is going in, and it's about making sure it gets to where it needs to get to.
Yeah, I mean, I think the fair cost of care is a really interesting one. I mean, what we need is in a sense a should cost model, isn't it? So that we an open book accounting on the part, especially the bigger providers, if you ask me. Okay, that's 11:58. I'd just like to say another really big thank you to our two speakers today and to SITFA, and also to all of you out there who have been sitting quietly and listening. And just to say that the recording will be on SITFA YouTube. If you want to read the report, it's on sitfa.org/sitfathinks /insight, if you want to track it down there. And if you want to spread the news of the report on social media, it's #SitFA Social Care, all one word. So just say a really big thank you, and I hope to see you at the next webinar.